There. So there's some interesting things that can kind of connect with the other two speakers. The last thing one of you said, Carrie, was delaying the progression. And hearing is really an avenue where we can help delay the progression of dementia, or specifically Alzheimer's. Now let's see if I can manipulate this. So again, I'm Barb Bentley. I am in the new medical center on Springbank Drive. So I guess it's not so new anymore now that it's been about 4 years. One of the things that I strongly believe is that hearing is what connects you to the people in your life. And that kind of goes in with what Dr. Grace said at the beginning, with communication involving both hearing and speaking. There are all sorts of parts to the job, much as Carrie spoke about what speech-language pathologists do. There are various things that audiologists do. Today, I'm going to just try to give you a tip of the iceberg. I could talk myself for a very long time, as those that know me know I have no trouble doing. I'm going to try to give you a Reader's Digest condensed version of how we hear, some of the connections with the brain and hearing, and how that might relate. So just to start with, this is a kind of a blow-up of your ear. And there are 3 sections of the ear. The outer ear, this is the part that everybody can see. The middle ear, and then the inner ear. And then this is the nerve that goes up to the brain. So if I start here with the outer ear, this is the part that collects the sound. It's going to go down your ear canal and through your eardrum. Then the sound goes through the eardrum. These little bones in your middle ear are the smallest in the body, and they're going to convert the sound. And then it's going to go through here. These are the, sometimes we call this, the stapes is sometimes called the hammer, and it will move the sound. And this part here, the cochlea that looks like the snail, that's the part of hearing that I'm most interested in, and this is the part for balance. The eustachian tube here, this is the part that equalizes the pressure. So if you've ever flown or gone up a mountain and you're trying to pop your ears, that's the part of your ear that's trying to equalize the pressure on each side of the eardrum. I'm not very good with this pointer here. So if we take the thing that looks like the snail, the cochlea, and we unravel it, there are sections that are responsible for picking up low-pitch sounds. There are sections that are responsible for higher pitches, and there are some for the middle pitches. And what's very common as we age, what tends to be affected the most is the higher pitches. That's the same thing with noise exposure as well. And this is a photo. So this is showing you inside, if we actually look at the little structures. So you've probably all heard that you've got little hairs in there. So we have these 3 rows of outer hair cells and 1 row of inner hair cells. And these little, the white here, these are the hairs that are on top. If you think of pipe cleaners, if you take a pipe cleaner out of a bag, it's nice and straight. And if you just kind of hold it and play with it a bit, even if you don't fold it, it never completely straightens again. That's kind of like what these hairs are. So over time, with age, noise exposure, certain illnesses, they're going to start to get a little bit bent. They're going to fall over, break off. And then we start, oops, sorry, wrong way. Then we start losing them. So we lose these ones first as hearing loss starts, and then as it progresses, then we start to lose a few more. So they're embedded in another membrane, and as sound comes by, it moves everything along, and then the signal goes up the auditory nerve to the brain. Well, now you have less of those hairs moving. You need sound to be louder, basically, so it's transmitted to the brain. So I know that's sort of a very simplistic view, but just to kind of give you an idea of all of the different parts that sound has to go through for even you to understand what I'm saying right now. So then it gets up to the brain, and then that's where your brain puts together with what you're hearing, visual cues, body language. So your brain takes all of that and puts together and figures out what's being said. So as you start to have some hearing loss, it starts with some of the high pitches. Lots of times people don't even notice that they're having a problem because your brain is what's compensating and it's filling in the blanks. If I'm sitting in front of you and I'm saying fun or sun, you don't actually have to hear the difference in a lot of cases because you can see when I'm talking the difference between an F and an S. If we're in a noisy place or we're at a table or I'm facing these ladies and you're trying to listen to me, well, now you might not be able to tell the difference with a little bit of hearing loss because you're not getting the visual cues. So all of these things are happening to help make it easier for you to hear. So what we haven't been talking about a lot until more recently is really how the brain plays into all of this. And the brain really has a bigger role than we think. So there's a strong correlation between dementia and hearing loss, and it's been documented more and more. We've known for a while, but there's been more longitudinal studies giving us some more information about this. And now there's also, with hearing loss, they've been actually able to measure there's brain shrinkage involved. So dealing with hearing loss is a way to slow down the rate of decline of dementia and Alzheimer's. If you were to take people in the early stages when just starting to notice some signs and were to take a large group of individuals and to test the hearing of those individuals, if you corrected hearing, a good portion of those people wouldn't actually be showing dementia signs. It's very hard to remember things and retrieve things if you haven't encoded them properly to start with. So hearing is a very important place to start by getting it checked, and if there is hearing loss, getting it corrected at the early stages. The earlier we do something with hearing loss in general for everybody, the better apt you're going to be able to adapt. Because the longer you don't hear sounds, the longer your brain gets used to not hearing them, the harder it's going to have to work to learn and get adapted to sound again. So it really is important to start this process earlier. I hear all the time, my hearing's not bad enough, I don't need to do anything about it, I'll wait till I absolutely need your help and then I'll come to see you. Unfortunately, often when we leave it that late, then you are going to have time adjusting to hearing again. It's kind of like people that live by the train tracks. They don't hear the trains go by. If you go to visit and sleep over, a loud train is going to bother you. I can remember in high school staying over at a friend's house who their house was right in front of the tracks. Their entire family woke up in the middle of the night because the train didn't come through. So how is that, right? No sound, and they wake me up, and there was a train derailment, and at that point, I just wanted to go to bed. I was a teenager, I just wanted to sleep. So your brain really plays a really large role. So probably the study that's gotten most people talking about was done at Johns Hopkins University by Dr. Frank Lin. I have a book at the back. It was really put together by one of the hearing manufacturers, meant for physicians, giving some different information about hearing loss and different conditions. But there is a nice summary, so if anybody wants a reference, there are some books at the back, and there's just a nice summary of a bunch of the different studies. But basically, even with people that have mild hearing loss, which a lot of people have mild hearing loss and wouldn't even think that they were having a lot of difficulty, other than maybe in noisy situations, they might say that, I feel like people are mumbling, or in a restaurant, I'm starting to have trouble hearing in background noise. That even, they had 51 out of 126 participants had at least 25 decibel hearing loss, had an accelerated rate of gray matter shrinkage when compared to the other participants. And as hearing loss got greater, there was more shrinkage in the brain. So the earlier the diagnosis we have of hearing loss, we can help correct it and hopefully slow down the rate of decline. Fortunately, I forgot one of probably the more useful slides for you. I forgot to include it in. But those with even a mild hearing loss are going to be 2 times more likely to develop dementia. Those with a moderate hearing loss are 3 times more likely to develop dementia. And those with a severe hearing loss are going to be 4 to 5 times more likely. So hearing is really huge, and we've sort of been ignoring that piece of the puzzle, that it is something that we can actually do to help slow things down, and it can make a huge difference. The other thing is if we wait too long, there does become a time that it becomes very hard, in particular for Alzheimer's patients, to deal with hearing aids because it's just too different. If we've got them in hearing aids and wearing for a long time before things get too bad, then usually we have a better chance of being successful. And if they can hear better, it's easier to communicate. So sort of my key thing is we need to do things sooner rather than later. So just kind of another number, adults with hearing loss develop significant impairment in cognitive abilities 3.2 years sooner than those with normal hearing. So pretty much everything is starting to show the sooner we look at things, the better. So I shamelessly stole these from a hearing aid manufacturer, but I liked some of their graphics. So really, better hearing does begin in the brain. So what we don't think about all of the different things that have to happen, but it's when the signal is compromised. So most people notice things if you're in a room and the acoustics aren't very good, or there's a lot of background noise. This is when the brain has to do a lot more work in trying to sort out what's being said and having to help fill in the blanks. I think maybe Dr. Grace, you mentioned something about depression. So there are some correlates between hearing loss and the rate of depression being higher, and because people are more isolated. So sort of the main things that the brain is helpful with, so orient, it uses both ears to know what's happening in the environment. The brain decides where sound is coming from by the difference in time that sound arrives at each ear. So with that information, I know if somebody's on my left or my right, in front or behind me. So we really need both ears for that, but it's the brain that decides where I turn my head, not my ears. The brain has to recognize what the sound is in order to make sense of it. I think one of you mentioned a foreign language. You know, lots of us can hear people speak in a foreign language, but if we don't recognize it, it doesn't really mean anything to us. So we can hear it, but it's not useful information until the brain can process it. And we need help focusing in noisy environments. So the brain's got to figure out, okay, what am I supposed to listen to? What am I not supposed to listen to? And trying to sort that out. So it's actively working as we're listening. So we're saying now that it's not your ears that hear, it's really your brain. So that is something that I think you're going to hear more and more about. So they do work together, and 2 ears really work together. When I first graduated, and we won't say how many years ago, we really just put hearing aids on 1 ear for everybody. And everybody came back saying they did really well in quiet, but were having trouble in background noise. And it wasn't until we started doing more research and realizing that we need to help more than just the ears. We needed to give that brain that extra information in order to sort things out. And even as I'm talking, all of these things are happening for you to process what I'm saying. So the one thing that I would like for all of you, regardless of whether you're here because of somebody else, but everybody really should be thinking of getting your hearing checked more regularly. So again, I stole this shamelessly from somebody in England, but I thought they were quite cute. We get your eyes checked regularly, and you don't go to the optometrist, you don't go with the intent that you have to get glasses initially. we get your teeth checked regularly. And again, you don't go to the dentist hoping for him to tell you that you have cavities. So I would like people to start thinking about getting your ears checked, not hoping to be told that there's a hearing problem, but also if we have a baseline, then we have something to go by, and then when something needs to be done, we can intervene. And I just wanted to show you kind of the graph of the speech sounds where we plot the sounds. So hearing loss starts in those higher pitches. So those sounds, the F, the S, the TH, and K, those are the first sounds that most people stop hearing. They're also the most visible. So a lot of people can be missing those sounds, and you're going to function just fine and not notice. Typically, when you start to notice is when it starts to involve this next little group, the P, the H, the G, the CH, the SH. Once that starts happening, it starts impacting more situations. And then these sounds typically are what is affected last. So I want to just end by saying, who's your audiologist? So you know who your doctor is, who your dentist is, who your optometrist is, and your chiropractor. So who's your audiologist? So please, all of you should consider getting your hearing checked, and your loved one that you're concerned about getting their hearing checked.